Hi, I'm Dr. Adam Crane. I'm the clinical psychologist with the Kane Center. This is the Behavioral Change Series, the psychological side of weight loss surgery. And today's topic, we're going to be discussing emotional eating. So as we do with our topics, we want to make sure that we have particular discussion goals, certain things that we're hoping that you'll be able to take away from this talk. That will give you better tools of how to be more successful with your surgery, understanding your weight loss, and understanding factors that may have contributed to weight gain before surgery. So the goals for today are to define and distinguish the emotional eating habits from regular eating habits, understand the different types of emotional eating. We want to be able to identify how emotional eating can have negative impact on weight loss success postoperatively. And lastly, we want to learn coping strategies and ways to challenge emotional eating habits and behaviors. There's a lot of changes that are becoming with your eating habits after the procedure and some things leading up to the procedure. It's always a good idea to understand what your problematic eating habits may be, if they do exist, and ways that you want to try to target those for best chances of success in the long run. All right, so just to get a sense about when are eating habits considered problematic. So normally we want to look at we look at an eating habit as being problematic when they're beyond what is considered typical, and they tend to create dangerous or self-sabotaging patterns. In other words, when they're done for reasons other than satisfying hunger. Appetite is really just about gaining fuel for your body and satisfying your hunger. And when you're eating for emotional reasons or other behavioral factors, or other things that are out of line of what you would consider to be typical or common for most people, that one tends to be more of a problematic eating behavior, eating habit. So oftentimes we can measure some of these on the emotional side because they're associated with things like guilt or shame or depression, anxiety. Normally when you want to satisfy your hunger, it's just to feel full and to feel that you've got enough energy to keep carrying on for the next several hours. And so as you go through the procedure, you'll be challenged to look at your eating habits in very different ways. And if you are experiencing your eating on an emotional level or beyond what is typical for behavioral level, it's going to be important that as we talk here, you pay attention to what habits and what categories you might fall into, so you know best how to understand ways to cope and make changes just to adjust. So overall, everybody eats for very different reasons. And there may not be one uniform way to kind of try to prescribe, but it's important that you just understand what your reasons are. As I said just a moment ago, we want you to create a plan that challenges your old food habits. If they're healthy habits, that's great, but the bariatric lifestyle and the bariatric eating habits require a certain amount of dedication, a certain amount of planning, a certain amount of organization. And we want to make sure that if there are old habits that kind of challenge those things or make it less likely for you to be compliant later, that you have an idea about how to be best suited to improve. So there is a window of time after your surgery to instill some of these new behaviors. Oftentimes your weight loss is most rapid within the first several months. And there will come a point in time where you have a leveling off, more of a maintenance phase of your weight loss. It gets harder and harder progressively to make some changes if you let it go too long. But I always advise people try to make the changes you can prior to your surgery. Just understand what your eating habits might be, where they might be problems, so that as you even embark upon the surgery, you're ready for the changes that are going to come afterwards. So the way that this discussion is going to be formulated and the way we're going to try to organize it, there's going to be a series of questions that I'm going to post onto the frame on the screen, and take a moment, read each item and answer it on a separate piece of paper. The items are all answerable by true or false, and we'd be putting up 5 at a time. And once I give you a few moments to read through the questions, answer them for yourself, there's going to be information I'm going to be providing to help explain what the questions mean, and depending on how you answered, what it means for you. So if you need more time, simply just pause your video and you can complete the questions as at your leisure. But each of these sets of questions will highlight a different type of problematic eating behavior or habit. And it's important that even if you don't endorse every question, that you at least pay attention to maybe some of the ones that you did, or at least pay attention to the ones that got you thinking a little bit, maybe out of beyond what you just took for granted. The questions are just meant to give you a sense about potential behaviors, even if they're not to the categorization of problematic. Just to even be thinking about your eating habits, hopefully there is something there that'll give you a chance to be able to make some changes or understand how post-operatively your new lifestyle will need to be adjusted. All right, so here's the first set of questions. Please go ahead and read these. And again, take your time, but answer them true or false. Okay, again, if you need more time, just simply pause your video. But in these 5 questions, if you answered 3 or more of these as true, there's a chance that you might be what we call a binge eater. So let's get into binge eating, what it is, how to recognize it, and maybe some ways that you can deal with it. So by definition, what binge eating is, it's a disorder or a disordered behavior characterized by eating more than needed to satisfy hunger and generally feeling out of control with your appetite. So the characteristics of binge eating, and let me distinguish that there's binge eating disorder, which is more of a clinical diagnosis, versus just binge eating behaviors. Now, you may just be someone who engages in binge eating behaviors, but regardless, it's still necessary that you understand if you do this kind of thing, because after the surgery, because of the size of your stomach, because of your desire to lose the weight that you'd like, you're not going to be able to binge eat in the same way. Your stomach will be too tight. It'll be too much restriction. And the studies have shown that binge eating actually dissipates after weight loss surgery. But as we'll get into, there are still some triggers that you're going to need to pay attention to that may increase some of your cravings. So binge eating behaviors are still important to recognize, but for binge eating disorder, you want to pay attention to certain things like having binge episodes roughly once a week for at least 3 months, eating quickly and past the point of fullness. If you're full and you find yourself still craving certain things and pushing yourself beyond the limits, that could be a sign as well. Having negative feelings of shame, guilt, or depression after your binge. And sometimes a characteristic is just eating alone, especially when you're not even hungry at all. So that's more of a dependence on food to self-satisfy certain feelings you may be going through. So if you do any of these things, obviously we want you to change those. And as you go through the procedure, you'll see that there's going to be certain restrictions in how you're going to be able to eat. So it's important you recognize the emotions. It's important you recognize your triggers. And just generally speaking, what do you need to do to try to make this a little bit easier for yourself as you go forward? So some background information about binge eating, especially binge eating disorder. It's the most common eating disorder in the United States, versus bulimia nervosa or anorexia nervosa. And this is when with binge eating, some people they associate automatically with bulimia, that they don't throw up or purge once they've already binged. So binge eating disorder is just the binging without the sense of purging afterwards, which is bulimia. So there's an estimated 2.8 million people that have binge eating disorder. And it was actually first recognized as an official diagnosis in the DSM in 2013. And just to distinguish it between women and men, it often begins in your late teens or early 20s. And it's most common in early adulthood in women. And for men, it usually develops more commonly in midlife. Some other binge eating facts are that the risk factors. Binge eating behaviors can have origins in your family history. Maybe it was a learned behavior. Maybe it was something that you were taught as a condition of how your family operated. Could be various psychological issues that do contribute to binge eating behaviors. And also patterns of dieting. I've spoken about this in other talks, but dieting, the way it's designed, is actually one of the biggest predictors of binge eating there is, based on the fact that you are restricting your eating. Oftentimes you hit a plateau, you feel cravings increase, and then we go to what's called reactive overeating. We tend to feel these cravings get to be out of hand and we overindulge. We eat more than we're supposed to. And then afterwards we feel guilty, we feel ashamed, and we go back on diets to try to recontrol ourselves. But classically, that reactive overeating is more typically known as a binge. And diets are very well known for that. As it says at the bottom here, you don't have to be overweight to have binge eating disorder. And being overweight does not mean that you have it either. About 2 out of 3 people with binge eating disorder do struggle with obesity. And 30% of people looking into weight loss treatments typically have symptoms of binge eating disorder. So again, as you go through this, you may not have a binge eating disorder, but you may have tendencies towards binge eating. To be really successful with the procedure and to minimize any discomfort that may come for you trying to either deprive yourself of foods afterwards that would normally trigger you, or to keep yourself from regaining weight, it's important that you at least recognize, is it a behavior or disorder behavior? In either case, just finding ways to better control for it and be mindful of maybe what some of the tendencies are towards it. So typically people will find ways to binge depending on the condition, but foods are usually the more common things that people pay attention to. So there are certain triggers, and more commonly people find that they binge on sweets or sugary foods, high carb foods, lots of breads, pastas, rice, things like that. Creamier foods, dairy products, ice cream, and so forth. Could be things like salty foods or spicy foods. So oftentimes we call these things comfort foods. And to understand what a comfort food really is, it's usually just a food that makes you feel good. It makes you feel better. You may be going through some stress, you may be going through some difficult times, and you feel that the need of the food to try to improve your mood or just improve your general well-being. So they're called comfort foods for a number of reasons. They're often associated with things of nostalgia. We can remember back to our childhood where maybe that kind of food was something that helped solve the problem or helped us feel better and cope with the problem when we were children or adolescents as we grew up. So it's natural that we're going to want to look for those foods now as adults because we remember them having some good effect for us and to help us just generally to feel better emotionally. Comfort foods are also associated with the need for social connection. And certain foods that remind us of meaningful relationships from the past and sometimes how those other people took care of us. Sometimes there's a nurturing quality to food. And when we're feeling depleted or we're feeling stressed or we're feeling worrisome or have some self-doubt, we don't always know how to take care of ourselves. So comfort foods have the quality of nostalgia, but they also associate us with relationships. Maybe somebody who made you a certain kind of dish growing up that was just love. It had an emotional connection to it. Maybe it was something that helped reduce pain and you just remember it being something that made you feel connected to part of your past. So we don't always like feeling alone. So sometimes food brings that to us, and comfort food certainly fits the category. Unfortunately, comfort foods are really no more likely to improve your mood than other methods, things like exercise or just journaling or positive self-esteem, and they can actually promote more negative moods. So while we think that the foods are doing something to help us feel better and helping us to make more connections, they're really not. Traditionally, they're just food, and they're just truly sometimes masking some more painful feelings that doesn't go away just simply because we find ways to deal with it in the moment through eating. So by promoting negative moods, those stress, depression, anxiety may still be there. Actually, eating poorly or eating certain comfort foods can elicit more feelings of guilt or shame, knowing that you ate the wrong thing or it wasn't what you needed to do to try to remain healthy or to keep losing weight. So you want to be careful that what you're choosing for a coping mechanism isn't food related, that there's other ways that you can find to cope with things of this nature. So as I was saying before, that having surgery has been actually shown to reduce binge eating behavior simply because of volume. You won't be able to eat as quickly. You won't be able to handle as much food. But the one thing I will emphasize, the triggers that lead to binge eating do not disappear. So your emotional triggers will still be there. You may still be craving certain foods. You may still be having a hard time dealing with certain emotions. And as a result, you may go seeking some of these foods out. You won't be able to eat nearly as many of them or in such a quantity or as quickly, but you still may go craving for them. So you want to make sure that this isn't something that over time you learn to eat in smaller quantities progressively as a way to still get that comfort feeling. Because what can happen is that it can over time lead to weight regain, and it's a form of self-sabotage. So again, you need to find alternative ways to cope with your emotions, identify your emotions, recognize what's going on, so you don't just mindlessly fall into some of these automatic behaviors that maybe were good coping mechanisms for you in the past, or at least so you thought were good. And it's helpful if you try to address those prior to surgery. So one of the things I like to try to encourage people to do is you want to identify your particular cravings as well as the circumstances you feel when you're unable to manage your food intake. And this is something that you can do by writing it down, keeping a journal. There's a way you can break sometimes your eating habits into 4 categories, and I'll tell you what those are here. So if you identify the types of food that you're most craving at a particular stressful time, at a particular emotional time, the first category is identify the types of food that you tend to be drawn towards. The second category, what are the circumstances? So in other words, is it time of day? Are you finding that you have more of a desire to eat in the afternoon versus in the morning, late at night? Where are you? So time of day, place. Are you sitting on a familiar couch? Is it when you're watching television? Is it when you're at your desk at work? So types of food, circumstances. The third category are emotions. What are some of the emotions that you might be feeling when you're having these cravings? Are you stressed? Are you anxious? Are you feeling depressed? Are you frustrated? And the fourth category is relationship. If you are someone who prefers to eat alone, understand why. Is it a concern about being judged by other people if you're eating certain things? Is it just that it's a time for peace and quiet? Or are you someone that eats socially? You tend to prefer to eat when you're with a group, when you're with your family, when you're with your friends. So if you write down these different categories, it'll help you to identify a more specific eating pattern. And this could vary. It could be specific to one type of emotion or one type of food, or under other circumstances, you may have different triggers. But again, types of food, types of circumstances, types of emotions, and types of relationships surrounding your eating habits might help make it seem a little bit more tangible, a little bit more concrete, so you know where to plan things out. So for example, if you find that you're someone that craves chocolate, and you tend to do it late at night when you're watching television after everybody goes to bed because you have had a really stressful, really overwhelming day. Well, you've identified that chocolate is the type of food, late at night in front of the TV are the circumstances, stress and feeling overwhelmed is the emotion, and by yourself is the relationship. So what can you do about it? Now that you know this, you either can get rid of the chocolate in the house, you can possibly turn off the television and do some other activity. Maybe that will interrupt the flow of the automatic nature of just indulging. You can call somebody. You can go to bed, depending what time it is. And that way you don't have to leave yourself susceptible to food cravings. But if you change the variety, go to a different room. Sometimes that changes the environment as well. But changing those patterns deliberately can help you to have a different kind of awareness, a different kind of insight about your eating habits, and therefore makes you feel a little bit more in control of what you're trying to change. And so you want to answer that question, is why food is your solution during these times, versus something else. And it might just be the feel of it, but if there's some other alternative that you can incorporate, probably for the better. All right. So in the next set of 5 questions, go ahead and please read these. And again, answer these true or false. And we will resume in just a moment. Okay, so again, if you need more time, please go ahead and just pause the video and answer the questions. But if you have answered these 5 questions with a true answer in at least three of them, so 3 out of 5 at the very least, there is a chance that you are what we call an emotional eater. And emotional eating, it sounds like a general category, but it is defined as using food as a way to accompany, compensate for, or cope with your various emotional states. So food usually becomes your way to replace limited coping skills. Typically, these are ways that we've learned throughout childhood about how to cope with certain emotions when we may have been confused, we may have been overwhelmed or uncertain. Food sometimes becomes the easier way to deal with things versus having developed other ways of solving our problems. Oftentimes they can be triggered by stress, sadness, excitement, celebration, anger. So this is why we were saying before that it's so important that you're clear on what your emotions are, just so you can help better prepare for possible connections to eating. Once you're restricted with your eating habits, you're going to be eating a very specific way. Of course, you're going to feel some emotion. There's going to be maybe some frustration. There may be some fear. There may be some longing for some old foods that you wish you can still have. But it's important that you at least understand what the connection to eating may be. Now, while this seems like a general category, it differs from things like binge eating because it doesn't have the same sense of urgency to it. So this can have a little bit more of a mindless approach where just you may be feeling something, and if you're unaware of what that feeling is, and you automatically just turn to food to self-soothe, you may not be as conscientiously aware of it. So it may not have the same kind of emotional guilt or consequences that it would if you were a binge eater. Now, I'll also clarify that emotional eating can be actually a pretty broad range because most of us do emotionally eat for one way or another at various points. To give you an example, if you've ever eaten at a birthday party a piece of cake, typically that could be considered emotional eating. It's celebratory. So sometimes we have some things that are just automatic associations with food. And one of the helpful things to try to do as you go through this is to be accepting that there may be certain times that food, yes, has an emotional component, holidays, more traditions, certain dishes that have been passed down over the years. There's going to be plenty of times where you can still enjoy some of these foods, but maybe just differently, maybe in limited quantities. The important thing is you recognize what is the trigger that leads up to it. So it doesn't become some sort of automatic behavior without any kind of control or any kind of recognition. So you can make better choices if this is a problematic area for you. Now, oftentimes there's some difficulties in recognizing emotional, or what we sometimes call head hunger, from our physical hunger. After your procedure, you may not have a lot of physical hunger. It may take a while for your appetite to really redevelop. So some people have some confused thoughts about, how do I know if I'm eating emotionally, or how do I know if I'm really just supposed to be eating based on physical cues? Well, there's certain ways to distinguish the two. So let's look at the two of them. So when you compare them, emotional hunger, typically people with emotional eating issues complain of feeling hungry often, much more frequently than what you would expect than if you were just physically hungry. For physical hunger, you tend to feel full a little bit easier. It lasts for a lot longer. But if there's more of a consistency with your hunger cues, with your appetite, it might be more emotionally based. The other part of it is the timing. Usually with emotional eating, hunger pangs are sudden and usually without any buildup. So in other words, they typically come out of the blue, sometimes just without any kind of warning, and we just all of a sudden might feel this intense hungry feeling. With physical cues, typically the hunger pangs are gradual. There's a slow gnawing, and eventually it builds up into a little bit more of a consistent hunger, easily recognized hunger feeling. And so if you have that gradual buildup, typically more physical. If it's, again, more sudden out of the blue, more emotional. And sometimes, and this is one that we're not always aware of, but it's important, that's why you recognize what triggers might lead to some of these emotional eating habits. Emotional eating cues sometimes are precipitated by a particular thought or situation. So if you are eating for any particular emotion and you just experienced it, and now all of a sudden you have this temptation to want to eat, there may be a connection there. Usually with physical hunger, there isn't any kind of emotional connection. There isn't some sort of thought that you've been dwelling on or thinking about consistently. And again, it would make sense if it's 12 o'clock, it's been several hours since you had breakfast, you might be hungry for lunch, more than likely a physical hunger cue. So as I was saying, timing is typically a good way to recognize the difference between the two. So if you do find that you're not sure, it's kind of hard to tell, wait 5 or 10 minutes, give yourself a chance just to kind of sit with it for a moment. And sometimes as simple as asking yourself the question, am I really hungry right now? What that does is it helps interrupt the automatic nature that emotional eating tends to bring. So sometimes when we're not aware of what our emotions are or what they bring, we have this automatic response, this automatic paired association. You feel something. If you've conditioned yourself throughout the course of your life to use food to soothe that painful or that overwhelming kind of feeling, you may not be as aware of what the emotional buildup is. So by waiting and slowing things down, you're building up a greater sense of mindful awareness. You are interrupting the automatic nature of the paired food association, and you could ask yourself more of a logical based question to kind of balance out the emotional nature of what that trigger might be. So in effect, this gives you more awareness. It also gives you more control, because if you can answer the question, no, I'm really not very hungry right now. Okay, then what am I doing? This is an emotional trigger. I need to walk away from this, from the refrigerator, from the cabinet, from whatever it is I have with me, and find some other way. So sometimes just waiting, asking yourself some logically based questions will help you to get a better sense. And you can even journal these things as well. So with emotional eating, one of the more important things that you're going to want to be able to do is have greater emotional awareness. Different emotions do tend to create different eating patterns. I know some people who feel extreme stress don't really have much of an appetite, but if they feel just a little bit of stress, they tend to be craving certain foods. So being aware of different emotions and the different degrees of those emotions can actually help you to create a better eating plan. So when I was talking to you about those 4 categories, the type of food, the type of circumstances, the type of emotions, and the type of relationships, the emotional component here, that one category, you want to be very specific and try to be as tuned into what kind of emotion you're feeling, so at least you have a better way of being able to make sure that if it is stress, you might eat a certain way. If it's anger or frustration, you might eat a different way. I know some people tend to turn to crunchier foods when they're feeling angry or frustrated, just to give them a little bit more of that kind of aggressiveness. Whereas some people that are feeling more depressed or sad, they may turn to creamier foods or just certain things like that. So be specific about what foods are more tempting when you're depressed versus when you're anxious, for example. And also, it's important to know that emotions can be harder to recognize when you are feeling tired or when you're feeling hungry. So just having a good sense of what kinds of, did you get enough sleep, and not confusing that for just feeling fatigue or feeling depressed when maybe you're just feeling just exhausted. So this is just a way to try to help understand the various types of emotions that are out there. You may have seen a chart like this in the past, but clearly there are a number of ways that we can feel. And depending on how your experience is with the bariatric journey, many of these can be elicited. Some people do feel frustrated, some people do feel excited, some people feel a combination of all the above. But just this is just as a little guide to help you get a better sense about, if you're not really emotionally aware, what some of the varieties can be. Now, I like to kind of identify this as just my way of thinking about it. You want to try to avoid it just sort of stopping at the primary, what I call the primary colors of emotion. Too often people identify just being happy or sad or mad. And those are a good start, but they're very general categories. And oftentimes they don't encapsulate exactly the intricacies of maybe how you're feeling. So you want to try to push yourself a little bit to see if you're feeling something more complicated. And I'll specify this. So in the case of happy, you might be feeling ecstatic, you might be feeling glad, you might be feeling pleased. And not many of these may have any bearing on how you change your eating habits, but they might. If you're sad, it might not just be sadness, it might be grief-stricken. It might be devastated. It might be severely depressed, mildly depressed, moderately depressed, just depends. So it might be dysphoric. So there's a lot of different subcategories to these different emotions. And this is just a tip. I want to kind of clarify with angry, because I think in being mad, because I think too oftentimes people don't quite understand the nature of mad. And oftentimes with mad, yes, it is what we feel, but typically what people don't recognize is that it is a secondary emotion. What I mean by that is that there's oftentimes a more vulnerable primary feeling that we experience first. We don't always like feeling that vulnerable feeling, so as a result, it gets flipped into anger. So, for example, feeling worried, or feeling guilty, or feeling ashamed, feeling disappointed, sometimes those are more vulnerable, and sometimes people don't like to admit to those things. It makes them feel weaker, or it makes them feel that they're just not, there's something more wrong with them. But the truth is, these are just emotions. We all feel them to a varying degree and on a continuum. But when we feel vulnerability, oftentimes what we can do to try as a defense mechanism is we flip it into anger. And what anger really is, it's a shield. It's a way of pushing back. It's a way of creating space for ourselves emotionally. So when we don't have to feel those difficult feelings that we are maybe sometimes less inclined to want to feel. The problem with anger is it doesn't give much of a plan. It doesn't give you much of a sense of what you're supposed to do. So, for example, let's say that you are feeling frustrated, and that's a difficult one to bear. So instead, you just turn it into anger. Now, the nature of frustration is actually, it's defined as an uncomfortable gap between where your life is and where you want your life to be. So, for example, if you're frustrated that you had it in your mind that you were going to lose 100 pounds within 4 months, and let's say you haven't gotten there, and you're frustrated, you don't know what to do about it, it's stressful, it's making you upset. Sometimes there's an inclination to blame ourselves or to be just disappointed, and that's hard to do. So sometimes we turn that into anger and we start to blame, and we start to look elsewhere for reasons why this happened. Unfortunately, when we start to blame, there's really not much of an impetus to make changes. We're trying to put the responsibility on someone else. So when we recognize the frustration that's underneath, we can actually do something with that because we can modify our expectations. We can recognize that there's that uncomfortable gap that we're able to say, you know what, I expected to lose 100 pounds in 4 months. Well, it hasn't happened. I need to change my time frame, or I need to modify my goal, or I need to change my plan as far as how I approach my goal. So now that gives you just a little bit more of an action plan to be able to go forward differently. And maybe that has bearing on your, not just your emotions, but also on your eating habits. Sometimes when people feel angry and frustrated, if they are in fact emotional eaters and they turn to food for that immediate soothing, that immediate coping, you're self-sabotaging without realizing it. So try to really get underneath the idea of anger and identify what is it that I'm actually feeling versus being mad, because maybe that gives you a better chance of how to improve your eating habits in the long run. Oh, and to this last point at the bottom, this radically accept and free your mind with anger. Sometimes we don't like feeling what we're feeling, but we do have to accept what it is. We do have to accept that we are feeling that feeling. It's not something that necessarily just goes away because we don't want to see it. Just because we close our eyes doesn't mean it isn't there waiting for us. So once you accept how you feel, so for example, if you feel guilt for having made a bad choice with your diet or with your exercise or otherwise, sometimes we don't like feeling guilt. It makes us feel bad about ourselves. But once you radically accept, once you say, you know what, this is just a feeling that I have, it's here, I have to sit with it, as just uncomfortable as it might be. It actually, studies have shown that it helps us to move on in a much more efficient and much faster pace. Guilt is something that doesn't go away. So the more we want to deny the guilt, it will be there waiting for us. If you accept the guilt, you can move on from it and you don't have to worry about having to feel it any longer, which gives you more mental energy to make different kinds of arrangements, different kinds of plans, engage in different kinds of problem solving. Okay, so go ahead and please read these next set of 5 questions and answer these true or false. And we'll be back in a moment and go over these. Okay, so again, if you need more time, please go ahead and pause the video and go ahead and answer the questions. But if you scored 3 or more true answers within these 5, there is a category of problematic eating and emotional eating that we refer to as self-esteem eating. And we have an entire talk devoted to self-image and self-esteem. It is a pretty important piece of the surgery. Oftentimes that if we don't feel good about ourselves, it makes it much harder to achieve our goals. But as we have it related to here, the definition of self-esteem eating, very simply put, is using food just to feel good about yourself. Now, conversely, you can also use food to reinforce a negative sense of yourself, depending on the food choice. And we will talk more about that in just a moment. But if you're a self-esteem eater, you're typically trying to improve your self-concept. You're trying to improve your mood. And it's not uncommon with people who struggle with obesity issues or depression or ways that they don't feel very effective in solving problems, or they doubt or question if they can be good at managing their stress. And so if they question their self-worth or their self-esteem, sometimes food becomes the natural coping mechanism. So people with lower self-esteem, they do struggle sometimes to lose weight post-operatively because they lack trust in their abilities. They don't necessarily have the confidence to achieve the goals they set for themselves. And what we're asking with the procedure is that you have a belief that you can lose this weight, that you can use this tool of the bariatric surgery effectively, that you can feel that you can be successful in the long run. And there are a variety of reasons why people may doubt. Certainly the history of dietary cycling. It's a vicious cycle where I talked about it earlier, that restrictive eating that lasts for several months, and then you start to get your cravings, you plateau, you start to make excuses, and then you engage in reactive overeating. And then of course, go back on another diet to regain control. If you've conditioned yourself enough times repeatedly, sometimes the message that comes through is that you're just not very good about losing weight. It must be you. And self-esteem gets impacted because people do believe that it maybe is something that they've done wrong. Whereas in truth is diet's been shown 95 to 98% of the time to not have long-term success for most people, which means only 2 to 5% of people typically are successful with diets. Part of the problem with low self-esteem, though, is that there's a feeling of isolation that comes about. People don't bother to compare themselves to others because they're worried that if it reinforces that, yes, they are bad at this, they don't want to face that. So we don't always have a good sense of perspective. And it just reinforces a sense that we're not going to be very successful in achieving goals. So if you have that mindset going into the surgery and you believe that you can't lose weight, or you have doubts that the surgery will be something that will work long-term because diets haven't worked long-term, you may be setting yourself up for more self-sabotage. You may not trust in yourself to achieve the goals. You may not seek the resources necessary to be successful down the line. So with self-esteem eating, if that is your belief that you're powerless to make changes, yes, it may be an unhealthy belief about yourself, but for a lot of people, it at least feels safe and feels familiar. There's a lot of vulnerability that may come from losing weight through the surgery. More people notice. More people are asking questions, but also we have to trust in ourselves that we're losing this weight. And again, if we don't have the faith or the belief that we are worthy of that kind of change, that may be a very frightening idea. Change can be difficult. Stomach is smaller, you lose weight quickly, but it takes your mind a very long time sometimes to get around the idea that you are deserving of this, that this can be lasting if you want it to be. So you want to make sure that you appreciate what changes are scary for you, and also be patient with yourself that those changes can take place gradually. In self-esteem eating, people might use food as more of a reassuring kind of friend, as a way to get that feeling of safety back if you have fears about what it would look like going forward. I have had plenty of people that as they've even transitioned from places like 200 pounds down to 199 pound on their weight loss experience, there's a nervousness about it as they approach the 100s. Why? Because they're not familiar with it. They're not sure what it's supposed to feel like. They've never been in the 100s, at least that they can recently remember. So they question themselves, can I live up to this? Can I handle this? Is this going to be something that's going to be really difficult for me to sustain? And there becomes a fear about it. As a result, sometimes they self-sabotage. They keep themselves from crossing that threshold because at least being in the 200s is familiar. It's something that just feels more easily recognizable. So food becomes that reassurance that they're going to be okay. Even when they self-esteem wise, they don't trust themselves to be okay. Food becomes that external thing that is the coping mechanism. It helps us to repress sad or just difficult emotions. And so like what we were talking about just a few moments ago with emotional eating, being aware of what your emotions are. Maybe what are your self-esteem emotions that contribute to your self-esteem? Do you feel depressed often? Do you feel anxious often? And this commonly occurs when we have an increase in self-focus. So as you lose weight, you are forced to look at yourself a little differently. Your clothes won't feel the same way. You'll look in the mirror and there may be somebody different looking back at you. So there's some difficulty accepting your new self-image that comes with the weight loss. So with more self-focus, Again, that fear sometimes comes about not trusting what you're about to encounter. And you may want to go back to some of the old ways. So pay attention to your sense of depression. Pay attention to your sense of anxiety. You can even write these things down. I like journaling. It's just a way to keep track of what the feelings may be. There are actually some ways that you can identify if you're having depressive thoughts versus anxious thoughts, just as a way to kind of have a better sense of identification here. So for depressive thoughts, it's going to be more personalized. It's going to be more self-critical. If you ever ask yourself, why me? Let's say you haven't done well with a diet, or you have a series of not doing well with diets or exercise programs. Why me? What have I done wrong? What did I do to deserve this outcome? That personalizing is more of a depressive style of thinking. And just a way to recognize if you're feeling depressed. The anxiety are more open-ended. They're more, a way to put it is if you're asking the universe an unanswerable question. So an anxiety-based question may be something to the effect of, when will this all end? How can I possibly keep going forward without knowing what's ahead of me? What is it that I'm doing wrong? Those are kinds of questions that make it a little bit more difficult to have a specific answer. And they may imply more anxious questions, more worry, more self-doubt. So just as a way to have more of a cognitive approach to understand what those emotions may be, and do they have impact on self-esteem? At the core of those, low self-esteem, if you're saying, why me? Not a very positive sense of self. If it's how much more of this can I take, meaning that you're not losing weight or you're struggling, that's a question about something is being done to you, and that you don't have the internal resolve or strength to be able to manage it or problem solve it differently for yourself. So again, more specifically, let's get into the idea of what challenges low self-esteem might bring to bariatric success. And again, if this is something that is an issue for you, we have an entire different course on this one, and it may be worth for you to take a look. But some of the challenges that low self-esteem brings to the bariatric success in the long run is just difficulty accepting your new self-image. This is if you have been overweight for a significant portion of your life, several years, to all of a sudden change into someone that is thinner. It's not always an easy thing to accept. Sometimes there's a fear about what that means. Sometimes there's a fear about what this is suggestive of, how you now have to act with people socially. What is it the expectation going to be? Sometimes you just don't trust the change. Again, you've never been able to sustain the weight loss, so therefore, why should you trust this? So sometimes just difficulty accepting that new self-image is a factor that low self-esteem will maybe cause some self-sabotage or some avoidance of what's necessary for long-term success with the weight loss surgery. Low self-esteem also impacts a feeling of deservedness. So there are people that don't feel deserving of the weight loss, and they're not appreciating their efforts that they made to get to the goals that they've reached. So I know there are plenty of people that will say, that they don't feel that they really did anything specifically to lose the weight. They give surgery the credit for doing it, that it wasn't them. And this is when we talk about that surgery is a tool. And it is so important to reinforce that it is not the end all be all, but it is the tool. It is the thing that will help you to get closer to your goal. But you need to be the one that takes charge of the steps you take along the way. So if you don't feel you're deserving of the weight loss, where is that coming from? Why don't you feel you deserve it? Is it a question about deserving to be healthier, to be happier? And if it is, that could be a very clear sign of low self-worth and low self-esteem. You need to be able to appreciate your efforts. You need to give yourself a sense of what are your, what steps, what concrete proofs do you have that show that you did things to try to lose weight? So in other words, did you do the grocery shopping? Did you make good choices? Did you stop yourself from eating beyond a particular fullness that maybe in the past you wouldn't have done? Give yourself credit for the things that have gone well. And that helps to build a better sense of self-confidence. Some other challenges that low self-esteem brings is it's hard sometimes to manage the expectations that other people may show and how to trust compliments. Sometimes when other people notice that we are losing weight, it makes us self-conscious. Now we don't feel that we're able to fail, because if we do, it'll become more obvious to other people. It'll just reinforce them seeing us as not being good enough. So sometimes if there's too much attention that other people bring, we may not like the spotlight. We may not like the idea that other people know that we're trying to lose weight, because as soon as we don't, or we plateau or level off in some ways, maybe the questions start to come. Maybe the message is being that we're not good enough, or we failed ourselves again sometimes. So low self-esteem means that we're trying very hard to make other people not notice how we may feel inadequate. So part of what we always encourage patients to say to themselves, to believe about themselves as they go through this procedure, is to really have trust that they are doing the surgery for themselves. If you're trying to do this for someone else's satisfaction, it's probably not the right reason to have the surgery. Will it have benefits and make you more active and involved with your family? Certainly. And that can be for other people, but the primary of it is to make you more available to them afterwards. So make sure that you're clear on why you want to do the surgery. Make sure that it is for your reasons. Make sure that with your self-esteem that you feel deserving to make these changes, that you feel deserving to feel that you can sustain the success of this, that you're worthy of it. Because as soon as you start to falter, or you start to question, or this becomes about somebody else, it may be easier for you to give up on yourself. One of the ways that I like to kind of analogize this is if you've ever flown, and when the speech comes on where they talk about the oxygen mask dropping in case of a change in cabin pressure, the flight attendant never says to you, make sure you put everybody else's mask on first. They never tell you to go take care of everybody around you before you take care of yourself. The instructions are very clearly stated. Please secure your own mask before you start helping others around you. The reason being that if you don't, you'll become oxygen deprived. You won't be very helpful if you're passed out. So you won't be passed out with the surgery as far as your lifestyle, but from a figurative way of looking at it, put your mask on, take care of your needs, plan your meals, schedule your exercise, do this for yourself. And in so doing, the idea of it is that you'll be able to take care of other people better. Low self-esteem also brings about dismissing non-scale victories. And this is what I was saying about be specific about your goals. Don't just have a lack of trust that you can achieve them, but give yourself credit for the efforts that you made to get to the goals. So non-scale victories can be anything from making better food choices, having your pants fit differently, pushing yourself to go a little bit further on the treadmill, making sure that you stocked your house with healthier foods than maybe what you used to have, taking a different route to work because it was just too tempting to go through a fast food drive-through. So those are all to be considered non-scale victories. They're the non-scale things, not weight related per se, that show that you have built a sense of reassurance, a sense of confidence, and a proof that you can do some things better than what the scale may read. And it proves that you're affecting change for your life. So try to get a better sense of those. That will actually help to improve self-esteem. And also, for some people, there's a feeling of shame or embarrassment that you had to have the surgery. I said this at the very outset of this slide. If you feel that, well, I wasn't able to lose weight through my dieting efforts, and, I had to do this, and I've been successful in other places in my life, but this just sort of goes to show that I'm not very good about the weight loss. There is something out there called obesity bias. And this is a very insidious, sometimes more obvious form of discrimination against people with weight issues that makes you feel sometimes blamed for being overweight. And so sometimes there is a feeling of shame that comes about that you had to have the surgery to lose the weight. To do your best to recognize what influences there might be about why having surgery is a bad thing. Maybe it's about converting it into an idea that this was actually one of the better things you could have done for yourself. That knowing that 95 to 98% of diets don't work for people and they're not able to sustain that weight loss, knowing that there's something that as a tool can really be helpful. Maybe it's empowering to know that good for you for taking your time and researching this carefully and taking the steps to better your lifestyle. So trying to find maybe a different framework to look at it might help you to build a little bit better self-esteem and allow you to feel that having surgery is actually a good thing for you. So what are some of the ways that you can try to improve your self-esteem? Again, find provable evidence about changes you're seeing and the things that you've specifically done to bring those changes about. Don't give the surgery too much credit. I'm the one that made the decision to have this. I'm the one that made the better food choices. I'm the one that planned my exercise out. This is as if you're giving your car too much credit for getting to a destination. Your car literally is the vehicle. It is the way that it gets you to from one point to another. But as your surgery is the tool that gets you from one point to another, there are changes, there are choices, there are decisions you're making along the way to make that work. With the car, you get to decide how fast you go. You get to decide the route. You get to decide the song on the radio. With bariatrics, yes, the tool is there in place to help make this easier for you to get there, but you get to choose the food plan. You get to choose the quantities. You get to choose the timing. You get to choose the exercise. You get to take care of yourself. There are different ways that you can find provable evidence that you're making changes for yourself that go beyond just the surgery doing it for you. I would encourage you every single day, try to find something that you are proud of that you have done. Self-praise, self-affirmations. I did a good job with this. Yeah, but I had the wrong kind of food. Yes, but I'm proud of myself for stopping when I did. I cut it short before it got to be out of hand. Give yourself praise, even for things. Find opportunities to give yourself some sort of positive regard. Identify your positive self-talk and your tools for being kinder to yourself. This is a long process. It's like I said, it sometimes takes your mind a long time to get caught up. You want to make sure that you're giving yourself opportunity to be patient, that even though the weight is coming off, your acceptance, your changing over of your emotional eating habits takes a little bit longer. Give yourself praise for what you're trying to do in a gradual sense. So avoid self-criticisms. Self-criticisms and negative self-talk can actually be automatic. We may not even be aware of them, just as we're not always aware of certain emotions that are coming to us that trigger certain eating habits. Be aware of the mental script that might be automatic self-criticisms. Once you recognize them, start writing them down, become more cognizantly aware, and do something to try to challenge them. And actually, that's a technique called thought challenging. Once you identify that negative statement, in other words, say to yourself, stop, hang on a second. Is that true? Is that accurate? What's another way I can look at this? What's a better way, a more positive way that I can give myself some credit or see myself differently? So for example, if you're someone who says, I'm bad at weight loss or I'm bad at dieting, hang on a second, that might be something that's been conditioned. The positive self-talk would say, I'm not bad at dieting. Diets just don't necessarily work for everybody. And also, I'm good at choosing nutritious food. I'm good at being organized with meals. I'm good with taking care of myself in other ways. And I'm good with being active when I'm able to be active, when I can go to the gym, when I can go for a walk. So now you found a positive self-talk. It gives you a little bit more encouragement to move forward. And sometimes when all else fails, you can just do something nice for yourself. This builds self-esteem as well. Buy some new clothes. Send yourself some flowers. Schedule time that only belongs to you. If you feel you're being too committed to other people's schedules, turn off your phone. Ignore your text messages. Sit quietly in your room. Do something that you want to do and don't let other people bother you. Make that time for yourself. Once you start to feel more deserving, much more your self-esteem is better and you feel that that is something that you are entitled to, sometimes it allows for a better sense of peace and ability to move on and continue to take care of yourself. All right, so please go ahead and read these next 5 questions and answer these true or false. Okay, so now for this category of questions, if you scored 3 or more true, there's a chance that you might be what we call a stress eater. And this is a very specific type of emotional eating, its own subsection, but it's basically just eating when you're feeling stressed or overwhelmed. It's usually based on more of circumstances being overwhelming for you, and food becomes the natural solver for you, much like with emotional eating. But again, we have an entire discussion on stress management because it is such a crucial part of not just for bariatric surgery, but for all of our lives, and learning how to be more mindful and learning how to cope with stress in better ways is usually helpful regardless of whether it's surgery or not. But stress can certainly have a negative impact on post-operative weight loss based on just poor eating habits. If you're not someone that has found that you can deal with your stress in healthier ways, you may be more inclined to turn to food as a way to just naturally self-soothe. And that can lead to greater weight loss or greater weight regain, or just even a slowdown in your weight loss overall. Eating to cope with stress typically interferes with just developing alternative ways to deal with feeling overwhelmed. And as a result, a lack of coping tools maintains problematic eating. So one thing begets the other. If you automatically turn to food when you're stressed, you're depriving yourself the opportunity to try to develop other ways to kind of satisfy self-soothing or to develop better coping mechanisms for stress management. Once you deprive yourself of those opportunities, you're more inclined to automatically turn to food as a way to cope because you don't know of anything else you can do. So with stress eating, it's so important that you identify what your stress triggers are. Are you going through a lot of stress throughout the procedure? Are things in your life just feeling a little bit less manageable, a little bit more overwhelming? What is it that's going on for you that you know you're going to have to plan for? And if you are turning to food as a way to cope, some of the tools that we talked about earlier will apply here. Asking yourself the simple question, am I really hungry right now, works in most of these categories. It gives you at least an automatic awareness about what you need to do differently, paying better attention to your appetite, and being more mindful of what you're going through and how to plan better. So with stress, there's all sorts of reasons why we feel stressed. It has a number of influences, but post-operatively, if you don't have better ways of coping or different ways of managing your stress versus with food, you are setting yourself up for maybe some challenges along the way. Now, one of the things to keep in mind here is what's called distress tolerance. This is at the core of a lot of stress management. And what this is, it's a term that refers to the ability to accept and just cope well with difficult emotions. If you remember what we were talking about earlier as far as the radical acceptance, being accepting, not necessarily comfortable with certain emotions as they come up, it frees us up to be able to move on from them. So distress tolerance is the same idea. It's the same concept that you can sit with your uncomfortable feelings, that you can accept your stress for what it is. So it's defined really as both the perception of your ability to sit with emotional pain and your behavior in tolerating difficult feelings. So you may sense that you don't feel you can handle the emotional pain that certain emotions bring, especially stress. Overwhelming, causes backaches, headaches, stomach aches, makes us more irritable. So if you perceive that you can't sit with these feelings, you behave in a way that maybe suggests that you won't have to tolerate it, hence stress eating. But if your perception of your ability to sit with emotional pain is better, if you know it'll be uncomfortable, but you know that you can do it, you act in a way that allows you to tolerate those difficult feelings better, thereby allowing yourself to make better choices with eating habits. So as I was saying before, emotions can't be avoided. They will be there for us if we don't deal with them in the moment. We need to be able to build our strength by enduring them. Food, typically, as it says here, is only a cover-up. It just masks that distress, and it fools us to thinking that we are dealing with our stress in a way that just because momentarily we don't feel any kind of emotional issues or any stress or overwhelmed, that tends to be very short-lived. And then we have stress piled on top of guilt and shame for the choice we made with some of our eating habits. So learning how to sit with that distress is going to be key. So part of this is, how do we improve stress eating based on that? Well, we need to be able to recognize that we can handle the stress that is coming. And you remember what I was saying earlier about frustration and how to define that. Stress and frustration go hand in hand. They're almost the same definition. Stress and frustration are defined as that clinical gap, that uncomfortable gap between where we want things to be and where things are. So the more our expectations are higher, but we don't have the tools necessary to try to bridge that gap, the more stress we're going to feel. If we recognize that we have the tools necessary and we have our expectations, then we can achieve that. We won't feel as much stress. So it's going to be about learning better coping skills and being better to able to pay attention to what tools we already possess to be able to achieve our stress. Part of that is it involves changing our expectations. If you have an unrealistically high expectation about something you're going to try to achieve, but you have no knowledge of how to do it, you might be feeling a lot of stress, a lot of frustration, a lot of worry. But if you break it off into smaller steps, if you give yourself a sense that you don't have to lose 110 pounds in 6 months, you just have to focus on losing 25 pounds. And then once you've achieved that, you can lose another 25 pounds and then another 25. You can achieve smaller successes along the way. Give yourself credit for some of those victories as you go. That helps to reduce your stress because it takes the pressure of having to do everything all at once. Setting unrealistically high goals tends to actually promote more depression and promotes more maladaptive eating habits. So smaller goals, more measurable goals helps to improve your stress, helps to make you feel more accomplished and give you more confidence that you can achieve something going forward, which is exactly what we're hoping you will do as you go through the surgery. A lot of changes that you're expected to make, but take them small stages, learn to get better at smaller ones one at a time until you feel more confident. You also want to accept your cravings. Sometimes trying to over-control an unwanted experience leads to more impulsiveness and so poor decision-making. You know, a lot of times people, when they're feeling stressed out and they know that they have a particular liking for certain salty foods, for example, they may try to deny themselves these things. They may try to push it out of their heads. They may try to say, I shouldn't, I'm not going to, I don't really want it. And it's this pep talk that they try to give themselves that actually what it does is it promotes greater tension, which makes it more difficult to manage your stress. You're actually creating more stress. There is something in psychology called prize envy, meaning that the more we crave something, the more we are deprived of something, the more that we can't have something that we want, the more that we are going to want it. So the more attention you bring to something that you can have, the more likely it is that you're going to want to have it. So it's not about trying to deny yourself the craving. It's simply about being aware of the craving, acknowledging it, that it's there, recognizing the connection between that and the behavior. Practicing mindfulness, being more present, being in the moment, recognizing what your appetite is, what that food, what that purpose it's serving. It allows you to free your mental energy. It allows you to be more at peace, and it allows you to be able to kind of solve your problems in a better way. So acceptance when urges arise requires less effort and brings more benefit. We're not saying giving into the cravings necessarily. We're just saying not denying it from your consciousness, and just being aware of it sometimes does help. And also try to remember your goals for why you've had surgery, why you went into this in the first place. Sometimes having a larger overarching kind of sense about why this is an important process that you're going through makes it an easier process, because the short-term gain of eating something that's more for stress management isn't worth it when you consider the larger purpose of why you want to lose weight in the first place. Some other techniques are just start a journal. Writing things down, getting it out of your head helps to improve stress. Exercise is one of the best ways that you can improve your stress. Your brain releases endorphins, helps you to feel better, helps to manage your stress. It also helps to prevent the release of excessive cortisol, which actually contributes, it's a hormone that contributes to your body holding on to weight and not allowing you to lose as much weight as you might like. As I said before, carve out some quiet time for yourself. Give yourself some space if you feel overwhelmed. Sometimes simplifying things, making things quieter, is easier to deal with. Engage in some hobbies, develop some hobbies, find some hobbies, do something that you feel is enjoyable that is not food related. And this last one here is actually a mindfulness exercise that I'll go over with you. It's just something that you can simply try. It's called WWW, and each W stands for what you can see here. So in our effort to try to get you to be more mindful and more aware, first W stands for what for. So if you are a stress eater or an emotional eater of any kind, what is this food for? What purpose is this serving? Is it stress management? Is it to help me not to feel depressed? What for? The next W is why now? Why am I triggered to want to eat this at this present moment? What happened that led up to this, that I'm needing food as a way to cope? And the last W is what else? What else can I be doing besides food? So what for, why now, what else? The what else is intended to develop other coping mechanisms, to find alternatives that will help you to achieve better stress management, emotional management, and so forth. Studies have shown that by doing this, it actually helps to decrease cravings. It helps to improve effectiveness of achieving goals, and that mindfulness helps you to get to your goals faster. Another thing to think about here is physical versus emotional hunger. We said about this earlier, that does sometimes have impact with stress. So physical hunger is often gradual. It's open to all different kinds of foods versus specific trigger foods with the negative. The origins are in your stomach. Emotional is in your head. Occurs out of a physical need versus paired with an upsetting emotion or an upsetting event. Emotional eating, again, automatic or absent-minded. Physical eating is deliberate planning, deliberate choices, and awareness of your eating. And physical hunger realizes that your eating is necessary and that you'll stop when you're full. Emotional eating is you don't necessarily stop when you're full, and oftentimes the result is guilt. So this is just a recap on that as it applies to stress management. This is the last set of questions. Please go ahead and read these and go ahead and answer these, true or false. Okay, so this being our last category, if you scored 3 or more true answers in this subsection of questions, then your emotional or problematic eating behavior may be what we call snowball effect eating, or simply put, grazing. And this is defined as eating gradually and oftentimes mindlessly to increase your food consumption. It's usually seen as chronic snacking throughout the day. Typically, we see this when somebody isn't planning their meals very well and they're just kind of grabbing something on the go because they don't have time to organize what they're supposed to be eating better. It'll be so important as you go through this procedure that you are aware of your grazing if you are a grazer, and also to be conscientious about planning your meals, to not let just handfuls of snacks satisfy your hunger for the time being. You need to have a certain amount of calories, a certain amount of nutrition, and sometimes grazing falls onto a category of not being quite aware of what you're actually consuming. So with grazing, you might make unnecessary trips to be around food. So if you're somebody that goes to the workplace break room, where you kind of wander into your kitchen several times and you're like, why am I even in here? You might be grazing. If you watch television and you have a bag of something or a bowl of something that you're not even aware of how much of it you keep mindlessly eating throughout the show or during the football game, that's typically seen as grazing. So it's conscientious awareness is what's going to be really important here. So with grazing, it's oftentimes easier to rationalize the overeating than during maybe planning your regular meals. Consciously being aware and you're eating something you're not supposed to, you might feel that guilt, you might feel that shame. With grazing, if you're not as conscientiously aware of what you're doing, it's easier to rationalize that maybe you didn't consume as many calories, you didn't eat as much as you thought. It's easy to forget maybe some of the things that you consumed. And as you can see, it's just more important that you have a sense of what you're doing. The impact of grazing after surgery or chronic snacking, it's easier to eat around your stomach restriction, and therefore it's easier to consume more calories. There are people that they've realized they can only eat a certain amount, a limited quantity, but if it's a limited quantity of a junk food or a negative, a bad trigger food, and they eat just a little bit, they allow themselves to get hungry again, they eat a little bit more. Things like carbs break down a lot easier, so they're easier to get through the restriction. You allow yourself the opportunity to consume more calories throughout the day. And in so doing, because you're not feeling your appetite on a regular, consistent schedule, it interrupts your proper meal planning, what we need you to do to be most successful. After surgery, grazing, like I was saying earlier, it's easier to intellectualize. This is an emotional trigger typically that causes you to want to eat mindlessly or to compensate for some emotional state. So it's easier to rationalize, it's easier to intellectualize what you have eaten, didn't eat, why you've eaten it, deny, or just to keep track of how much you've actually consumed. So there may be some question marks about maybe you aren't losing the weight you want, but if you're grazing, it's going to be harder to understand the reason why or to understand what your calorie intake looks like to make it easier for you to be successful going down the line. And the last thing here is grazing actually helps perpetuate emotional eating triggers instead of finding better coping strategies to deal with your problems or your feelings. So it's going to be so necessary that you are aware of your emotions. It's going to be necessary that you are aware of your triggers as far as why you might want to eat. Be aware of your behaviors and keep in mind what your goals are, because as we embark on this journey, being aware of your problematic eating or your emotional eating habits can make it easier for you to be successful in the long run. Not being aware obviously makes it more difficult to plan and to be successful once you've hit that maintenance phase of weight loss. So as we go through these, I hope that there was something that you took from this talk. Either you recognize that you were one of these categories, or maybe you fit into several of these categories. Even if you didn't fit into any categories cleanly, maybe you endorse one or two questions here and there that at least gives you something to think about of how to be most successful down the line. So the whole idea is just to build better awareness, better willingness to make some changes, and just to recognize how some of these eating habits have been ingrained in us for quite some time. And as you embark on the surgery and we're asking you to make some of these changes, that you find some different alternative ways in which to be better successful. Thank you very much.